So I'm a Bernie bro, okay? You know that. And there's a tension. There's a feeling among a lot of Bernie supporters that there's this still tension between establishment Democrats and progressive Democrats, and a fear that the DNC or the official Democratic Party won't give progressive candidates a chance, won't really strongly support progressive candidates. What's your response?
Well,
do you see that?
My response is that absolutely we're going to be supporting great candidates. And you look at our platform. Our platform is the most progressive platform in the history of the Democratic Party, Bill. I worked for Ted Kennedy. Ted Kennedy always said to me, Tom, someday I want people to look at me as a proud leader in the accomplishments wing of the Democratic Party. And he understood that what we were doing as progressives was making progress on behalf of working families. And he did a lot of that, and I was proud to play a small role in that. And that's what I carried into my job as labor secretary, taking on fights. And what we want in our candidates, what we want in our party, are people who are fighting for the underdog, people who are taking on those tough challenges, whether it's fighting Trump on climate, fighting Wall Street on overreach, fighting the Muslim ban, fighting for immigrants, fighting for a woman's right to choose. That's what we're about.
And is Bernie part of this process?
I hope so, and that's why we traveled together. He has touched such passions in people and inspired passions in people. And that's why we traveled together for almost a week, because I understand that many of the folks that I met were not registered Democrats. And my goal is to win the hearts, minds, and votes of those people.
Of those people, right.
Here's a comment, question, I should say, from the YouTube chat room, youtube.com/TheBillPressShow, from Dan Grzinski. Will the Democrats ever support single-payer health care?
Well, I support health care for all, and our platform very unequivocally says that health care is a right for all and not a privilege for a few. If I were, king for a day and could do everything on my own, I would certainly have something either like Medicare for all or single payer. But right now, what we have to understand is there is an unmitigated effort to repeal what was one of the most important additions to the social compact in 40 years, and that was the Affordable Care Act. And 23 million people are in danger of losing their health care. I talked to a person last week who said, I'm diabetic and I'm scared to death that I'm going to lose my health care coverage. I talked to a family of triplets, and one of their triplets had a year in the hospital, $1.5 million in bills. Because of the Affordable Care Act, they didn't have to file for bankruptcy. And they fear for anybody else who may be giving birth to triplets in the future. And so what we have to do right now is fight to make sure that we tell that Donald Trump voter who may have someone in their family fighting the opioid epidemic that when you go after Medicaid, or when you attempt to repeal the Affordable Care Act, or when you implement the budget that they've put out there, you're hurting folks. And so we have to play this defense right now. It's critically important. And at the same time, we need to articulate our vision. And our vision is, we believe that health care is a right for all and not a privilege for a few.